Good morning, good afternoon, good evening, depending on where you are. It's my pleasure to welcome you to this webinar on the role of South-South and triangular cooperation in addressing the triple burden of malnutrition in children and the potential contributing to achieving the SDG 2 targets. My name is Addy, and I'll be your host for this period. This webinar brings together governments and partners to discuss solutions, successes, and challenges in delivering the Sustainable Development Goal 2 on zero hunger, as well as the targets under the Malabo Declaration. Reducing the prevalence and eliminating malnutrition and undernutrition in Africa. It's our collective responsibility to the children of Africa and to the world. Indeed, no child should go to bed hungry. And I can tell you that hunger is a very, very painful experience. Yet so many of our children experience hunger. In choosing nutrition as the theme of the year for 2022, the African Union sent a clear signal and a clear message and commitment that ending hunger and eliminating malnutrition and undernutrition in Africa are priorities for the continent. Through a variety of national intervention and investments in order to strengthen the nutrition-sensitive food systems and sustainable agricultural production, governments are committed to finding solutions. South-South and triangular cooperation plays an important role in promoting learning amongst countries, increasing access to relevant and long-term technical assistance, and strengthening government's leadership in seeking solutions and learning from experiences of other countries. But also sharing their own knowledge and solutions. Mutual learning is at the heart of South-South cooperation. I'm pleased to have with me very experienced and eminent speakers who at this point I'll invite, you can see them on the screen, and I also invite them to wave each and every one of you. So you can see the eminent speakers that we have on this call, and I'll introduce them in the course of the webinar. I'm sure all of us have a lot of experience with using Zoom, but let me suggest to us that you should use the chat box to have conversations among yourselves, and indeed engage with this conversation. We'd like this conversation to be extremely engaging and participatory. So use the chat box to chat among yourselves. But also use the Q&A box or button, press on the Q&A button to ask specific questions to the panelists. We'll try and make time for you to ask your questions during the course of the webinar. But as much as possible, please use the Q&A button to share your questions. So without much ado, let me trigger the beginning of our conversation by inviting Mr. Jean-Pierre De Margerie of the World Food Programme. Mr. De Margerie is the Deputy Director of Programs, Humanitarian and Development Division of World Food Programme at headquarters. and he's here to provide us with some opening remarks and some inspirational words to inspire us. He's a seasoned humanitarian and development assistance professional with over 30 years of experience in the area of food security and nutrition. He has a very close experience and knowledge of hunger, practical experience, and I've been dealing with it almost throughout his 30 years and over career. He has a lot of field experience, but let me share a few. He served as the WFP country director in Rwanda, Cambodia, and North Korea, where he also took responsibility as a UN resident coordinator for over 1 year. He's worked in Nepal, Thailand, and East Timor. Mr. De Margerie, it's my pleasure to welcome you to this webinar with a lot of excitement and to ask you to take the floor. The floor is yours, Mr. De Margerie.
Thank you, Dr. Edward, and hopefully you can hear me well. I am indeed based in WFP headquarters in Rome, but very happy to call from Lusaka today in Zambia. And a warm good morning or good afternoon to all of you on the call today, and to thank you for taking the time to join us on this very important subject. So it's a great pleasure, Dr. Edward, to be here with all of you. First, let me express my thanks to colleagues of UNICEF and AUDA-NEPAD for joining their efforts with WFP to organize this webinar. Also, I'd like to thank the socialprotection.org team for hosting the event. This webinar is a breakthrough event, we believe, as it marks the start of a collaboration between WFP, UNICEF, AUDA-NEPAD on South-South and Triangular Cooperation, or SSTC, as we call it. The aim of this partnership is to support countries in Africa to advance their progress on nutrition by tapping into the wealth of resources, expertise, and homegrown innovations available in the Global South. By expanding their long-standing partnership to include SSTC, WFP and UNICEF are jointly responding to the call of the second high-level UN conference on South-South cooperation, known as BAPA Plus 40, which I had the pleasure to attend in Argentina 3 years ago. And on that occasion, representatives from developing countries requested increased support from the UN to engage in South-South cooperation, including through enhanced interagency collaboration. This call from the growing awareness that SSTC is a powerful tool to accelerate country-led progress towards the SDGs. The UN has recently approved the first UN system-wide SSTC strategy with the aim to ensure more coordinated and coherent support to member states on SSTC and an increased impact across UN activities at all levels, global, national, regional, and local. The SSTC partnership between UNICEF and WFP is a concrete contribution to the implementation of the UN system-wide SSTC strategy, as well as the African Regional Nutrition Strategy. WFP and UNICEF are well positioned to help African countries capture, document, and share their good practices and homegrown solutions to achieve nutrition targets. They can do so by leveraging their experience as effective SSTC brokers and their long-standing collaboration with national actors, including governments, NGOs, private sector companies, as well as regional and sub-regional institutions such as the AU. As SSTC brokers, WFP and UNICEF can facilitate knowledge exchanges at policy, technical, and grassroots level to do many things. For example, to foster an intersectoral approach to policymaking, to promote a nutrition-sensitive approach to national transformation pathways, to strengthen the capacity of national actors to design and deliver nutrition outcomes, and increase investments and mobilize multi-stakeholder partnership on nutrition engaging both public and private sector actors. SSTC is a key pathway to realize the vision of the African Union theme for 2022, and I quote, building resilience in nutrition on the African continent. Stepping up UN support to South-South cooperation has become more relevant than ever as countries face the challenges to recover from COVID-19 devastating impact, and this phase or opportunity we have now to build back better. WFP is strongly committed to work hand in hand with UNICEF and AUDA-NEPAD to identify the most relevant avenues to support the ambitions of African countries to build resilience in nutrition. I wish you all a very rich and engaging discussion today. Thank you so much. Back to you, Doctor.
Thank you very much, Mr. De Margerie, for really admonishing us, but also for reinforcing that this is a partnership. And throughout your remarks, you reinforce the importance of partnerships. But you also reinforce the importance of partnership with a purpose, to help us document, and to help us learn, and to help us scale. And really, it's about doing something about the hunger that our children face today. Thank you very, very much for joining us from Zambia. So it's now my pleasure to introduce our next speaker, who I have a feeling doesn't need very much introduction, but let me nevertheless introduce Ms. Rhoba Kefilwe Moalosi, who is the Senior Nutrition and Food Safety Specialist and Acting Head of Nutrition in AUDA-NEPAD, the African Union Development Agency. Ms. Moalosi provides technical support to United Nations Food Systems Summit dialogues for the African Union member states and the regional economic communities, as well as development partners in planning, programming, and implementation of the Global Nutrition Agenda and African Union Agenda 2063, including the Malabo biennial reporting of member states. Ms. Moalosi played a key role in developing the AUDA-NEPAD Nutrition and Food System Implementation Strategy 2019 to 2025, and the implementation of the UN Food Systems Summit. Prior to joining AUDA-NEPAD, she served for over 7 years in the Ministry of Health, Public Health Directorate as a Nutrition and Food Safety Officer in the Kingdom of Botswana. It's my pleasure to welcome you, Ms. Moalosi, to address this webinar. The floor is yours, Ms. Moalosi.
Thank you so much, Dr. Edward Addy. I'm also honored to be here today, and thanks to all the organizers, including ourselves, for creating this platform to discuss issues of hunger and malnutrition in the continent. Mr. Fernando, can I have my slide, please? Thank you so much. Yes, I'm sure now you know my name is Kefilwe Rhoba. I'm working for the African Union Development Agency, known as NEPAD. Please go on to the next slide. Well, just to present the outline of the presentation today. Next slide, please. Thank you so much. I think it's very important to showcase what is the global status on nutrition and food security. And this is taken from the Food Security and Nutrition in the World report for 2020 that showcased that the world is not on track to achieve the zero hunger. And I think we're here to address what is really the issue in global, also in the continent of Africa. According to this report of the food security, shows that number of hungry people has been slowly on the rise since 2014. And of course, the COVID-19 also exacerbated the situation on the ground. I mean, we have experienced challenges having food systems disruption across the region in Africa, whereby we even have some borders that were closed and a lot of people could not actually access food, for example, and also the price volatility was also a challenge. This report also shows that by 20 million in 1 year, there will be increased a rise on hunger, and by nearly 60 million in 5 years, we'll experience hunger. Just yesterday, watching the BBC News, I realized that in Afghanistan now, they are hit by hunger. A lot of children are really dying now in Afghanistan, so you can imagine what will happen by the time we reach 2030. Next slide, please. So now zooming into the African continent, the AUDA-NEPAD in 2019 actually did the overview of nutrition in Africa. And this also was aligned with the Malabo Declaration indicators, of course, looking to the SDGs and the World Health Assembly targets that the AU Africa Nutrition Strategy also stipulates. We look into some few key indicators. One of them was prevalence of exclusive breastfeeding of children from 0 to 5 months. We also look into the prevalence of stunting of children under 5 years of age. We look at the adult overweight, and we know that obesity also is also a challenge. We also look into anemia of women of reproductive age from 15 to 49 years of age. So as you can see in the slide right now, when you look at the adult overweight of body mass index more than 25, as you know, if it's more than 25, it means it's overweight. And over 30, then we talk about obesity. So for example, the prevalence of overweight in Africa is actually very common in the North African region. If you look at the chart now, look at the slide, for example, we see Egypt, for example, leading when it comes to adult overweight. But also in the Sub-Saharan African region, we have South Africa, Swaziland, that we see a lot of adults being overweight. We're also aware that even for children, also they're also experiencing obesity and overweight for children as well. If we look into the anemia of women of age between 15 to 49 years, this is actually high in from the Central Africa region. Look into Gabon, look into the Gambia, where it's 67.50% of women that are actually anemic. So this is also still a challenge, but also look into the other region, not just Central Africa. If you look into the Southern Africa, we see Mozambique. Looking into West Africa, we see Mali as well. So this is actually a problem that we are facing in Africa. And like I mentioned, this was actually showcased against the Malabo Declaration indicators, that we have 17 indicators under Malabo that really speaks to addressing issues of nutrition and food security. The issue of exclusive breastfeeding, it is still a major challenge in Africa. If you look into the red dots in the map right there, more than 40%, of children, of people are not really practicing exclusive breastfeeding practices. If you look into, for example, a country in West Africa, looking into Benin, for example, there's still a challenge in there. Also in the Southern Africa, we look at Namibia, it's still a challenge. If you go to, for example, countries in the East African region like Uganda, Rwanda, we still have see so many challenges when it comes to exclusive breastfeeding issues in Africa. So that is still also a problem. And most of the countries in Africa really are off track when it comes to really global nutrition indicators, as well as the African indicators that I just alluded to when you look into the regional nutrition strategy that the AU have actually developed. Next slide, please. Now, as I mentioned, the issue of the Malabo Declaration, we do have the 7 commitments that were actually done under the Comprehensive Agriculture Development Program, which is CAADP, where our heads of state in 2014 actually agreed to these 7 commitments. I'll just focus on the one that speaks to issues of hunger in Africa. Ending hunger by 2025 is also still a challenge. We have done like 3 reports of the Banner Review reporting, which shows that most of the African member states also are off track, just focusing on the ending hunger issues. Next slide. Now, this is just the outcome of the banner report that was done in 2019 and also done in 2021. So now, as you can see, the report now shows that 48 member states are not on track. And we only have one country, member state, that is on track in terms of achieving the Malabo Declaration by 2025 by ending hunger. And this country that is actually on green is actually Uganda. When you compare this with the 2021 report, now we have 49 countries out of 55 that are not on track. And now at least there are 2 countries that are showing some, green light. For example, we have Rwanda there, and as the member states are on track, and you see also Kenya as one of the countries on track. But just to say that more and more countries are off track. And like I mentioned, the COVID-19 actually has exacerbated this issue. So it means that even the next upcoming banner report, we have more and more countries that are really off track. So it is still a major challenge in Africa, not only achieving the SDGs, but also achieving the Malabo Declaration commitments by 2025. Next slide, please. Now, at least we do have very, very strong and practical strategies and frameworks on the ground to really support the AU member states in terms of attaining some of these goals that are set. For example, we do have the Agenda 2063. In there, we have goal number 3 that speaks about having well-nourished citizens. And we do have the nutrition and food systems that AUDA-NEPAD actually developed in 2019 to really support some of the member states in terms of programming nutrition and food systems. And lastly, we have the African Regional Nutrition Strategy that also speaks to the 6 global nutrition indicators. In there, we do have the indicator of exclusive breastfeeding as well, and others that are also stipulated in the World Health Assembly goals. So this is what we are really supporting the member states with in terms of also developing regional nutrition strategies. For example, in the Southern Africa and SADC, when they were designing or formulating the regional nutrition strategy, we actually shared with them these key indicators or key frameworks, but also taking to the global frameworks that are also existing, of course, looking to the SDGs as well. So these are the frameworks that are designed to support and to guide the member states going further. Next slide. I think also it's very important to note that our heads of states also do look into the practical key solutions in terms of what can work on the ground. For example, in 2016, Homegrown School Feeding program was championed as the key program in terms of boosting income generation and also boosting local communities. Now, Homegrown School Feeding program also has been championed every year on the 1st of March, to commemorate the Africa Day of School Feeding program, whereby we discuss issues that can be done to improve the school feeding program in Africa. And we as AUDA-NEPAD as well, we also support and really scale up the Homegrown School Feeding program. We are working with many countries across Africa and working with different partners such as the WFP program in terms of ensuring that the school feeding program in Africa has also been strengthened, and we improve the issue of linking the smallholder farmers to the school so that they can also have, create work and also improve the household food security as well going forward. So at least our heads of states also, they do commit to some nutrition activities in the continent. Next slide, please. Now, just recently, during the 7th Africa Day for School Feeding program, the AUDA-NEPAD, in collaboration with WFP program, also launched the guidelines that is developed to design and support the implementation of Homegrown School Feeding in Africa. So in this is just to provide a quick guide or quick reference for the African member states to really, when they formulate their policies, to look into what are the key elements that they should consider in improving the program around school feeding, and of course the policies that matters when it comes to the Homegrown School Feeding program. This is actually ongoing now. We're disseminating the guideline with many member states, and some of the member states have reached to us to support them in terms of also developing their own national guidelines, such as, for example, Nigeria. We have countries such as Botswana also that are looking to the guide to really support them in terms of developing the comprehensive national school feeding policies on the ground. So we are trying by all means to ensure that we get African member states on track to address issues of nutrition and food security in the continent. Next slide, please. Just to also to share that we do have advocacy materials that we use in terms of promoting investments on nutrition and food security in the continent. Last year, for example, we launched the African Union Biennial Report during the Africa Day for School Feeding program and school feeding as well. So inside this report, we showcase some of the case studies, that can also be replicated across Africa in terms of improving school feeding program in Africa. And we do this in support of other partners such as UNICEF, WFP program, the FAO, the SEFAM of WFP, and other key partners that also contribute to the improvement of school feeding program in Africa. We are also able to develop some key lessons from different countries such as Botswana, Ghana, and Nigeria in terms of how they actually implemented the school feeding program on the ground and how they're working with other key sectors such as education, health, agriculture, social protection on the ground to improve the situation of the school-going children, and as well as coming up with healthy school meals for the school-going children. So this is something that we are trying to do in terms of really showcasing or sharing some of the best practices or some key examples from the African member states. Next slide, please. Now, when it comes to the food systems, we are actually still providing support to the member states. Just on the 2nd of March, 2 weeks ago, we held another meeting with the national conveners to support the implementation of the key commitments made last year during the Food Systems Summit. And on top of that, AUDA-NEPAD also have developed the African Common Position that was also led by also AUC and other key partners that actually provided a key role in terms of positioning Africa when it comes to the Food System Summit. And these outcomes, this is what member states actually designing, on top of developing the national pathways on food systems. They're also trying to ensure that this is also linked to the work that is ongoing. For example, key speaker mentioned that this year is declared as a year of nutrition. So how best are we providing synergy on what transpired last year and what we're going to do in terms of implementing nutrition as the year of nutrition and year of AU as well. So these are the things that we're trying to provide or lead as AUDA-NEPAD to ensure that there's that cohesiveness of programs on the ground. And we have also developed a platform like a knowledge hub where we can also share information across and also keep on supporting member states in redefining the issue of nutrition on the ground. Over. Next slide. Now, when it comes to research and development in Africa, we've been working a lot with the World Food Program and AU, of course, in building evidence-based studies such as the cost of hunger studies in Africa. That also shows the social and economic impact of child undernutrition. And we have more than 21 countries actually that have conducted the study and launched the report that shows evidence that shows that if you don't invest in child undernutrition, you're actually losing a lot, and the GDP actually is increasing because of not investing on child undernutrition. Now, for example, this report also shows that the countries in Africa are losing around 1.9 to 16.5% of the GDP if they don't really invest on child undernutrition. Now, recently we have a discussion with the World Food Program in Africa, whereby we want to really start working on the cost of investments. And we'll be using these 21 countries to actually come up with a methodology on also costing the cost of investments, because our leaders want to see the numbers. What are we referring to if you say they should invest in child undernutrition? And we do hope that this will contribute to the year of nutrition as well. Next slide. Just to share the key findings from the cost of hunger studies. I mentioned the one on GDP loss as well. And also we also look at the stunting issue as well. We look at the productivity, for example, 47% of current working age population suffer from stunting as children. So when you do the cost of hunger studies, it actually focuses on key elements, which includes productivity, the health issue, and of course, the education impact of not investing on child nutrition. And these studies actually used also to inform our leaders when it comes to promoting investment in nutrition. So we are trying to get to do the cost of investments, and I think this year we'll be able to work with some few countries to come up with the cost of investments of not investing in child nutrition. Next slide, please. Now, to conclude, we look at the Global Nutrition Report that also shows that what needs to be done to strengthen the investments on nutrition way forward. What should the government do to ensure that they tackle the issue of nutrition in the continent? One of them obviously is to really show government commitment by putting resources, even allocating national budgets to nutrition. Reports have shown that there's a little that is actually being allocated to nutrition. Some countries, they do try, some don't put anything when it comes to nutrition national budgets. For example, we also noticed that countries like Benin, this year, obviously, they have actually increased the budget allocation to school feeding as an example. But other key sectors or other key elements that really contributes to the issue of nutrition is also around the issue around private sectors. How do we get private sectors to also invest in nutrition? So this are the things that we are trying to put back in place and try to really provide some action on the ground to increase investment on nutrition. And by doing so, we hope that many African countries will be on track come 2030 in terms of addressing SDG 2 going forward. We also want to focus on what the community are doing. How do we bridge the gap between the vulnerable groups that are most affected by hunger, for example? How do you really resuscitate those elements? So this report really is providing more technical advisory to many member states going forward. And as AUDA-NEPAD, we really want to encourage member states to look into these key reports that are available online in terms of improving their policies, improving their frameworks going forward. Next slide, please. So this is my last slide, just to end by reiterating that this is the year of nutrition. It's a time for us to really make noise, and maybe we have more funding, especially in the African member states, allocated to nutrition improvement in the continent. Thank you for your attention. Over.
Thank you very, very much, Ms. Moalosi, for the excellent overview of the state of nutrition globally and more specifically in Africa. But let me highlight 3, 4, 5 messages that I'm taking home. The first is that too many of our people are hungry. 30% stunted, close to 40% of our women are anemic, and though breast milk is free, only 40% are offering exclusive breastfeeding. The second message that I heard is that hunger is actually undermining our economies. Between 2 and the cost of hunger is up between 2 and 16, or even between 2 and 20% of GDP. But the sober news is that only one member state is on track to achieving the Malabo Declaration, and I think they are doing something that we should document and learn from. The fourth message is that our heads of state, the policy, and there are lots of policy framework, and there's a lot of commitment within the continent from heads of state. So the last message is that we need to step up our actions. Thank you very, very much, Madam, for the excellent presentation. It's now my pleasure to move on to the next presenter, who is Miss Paulina Addy. Miss Paulina has a Master of Philosophy in Nutrition from the University of Ghana. She's currently the Director of Women in Agriculture Development Directorate of the Ministry of Agriculture of Ghana, and has led several activities, including the promotion of optimal nutrition from the agricultural lens, enhanced food safety and value addition to agricultural products. And gender mainstreaming has been part of her work. Ms. Addy has a lot of experience at the district, community, regional, and now at the national level. She understands the whole landscape and comes face to face with hunger and agriculture each day. She's currently coordinating and convening the Food Systems Summit National Dialogue on behalf of the Ministry of Food and Agriculture with the National Development Planning Commission. And she has kindly agreed to share Ghana's experiences in nutrition in the Malabo Declaration Biennial Report. Ms. Addy, the floor is yours.
Thank you very much, Dr. Addy, and thank you for the opportunity to be part of this webinar to share experiences from Ghana. And thank you too for agreeing to manage the slides on my behalf. Please, can I ask for the next one? Yes, Ghana is plagued with the triple burden, as it happens all over the Africa region. And at the moment, we have the micronutrients, malnutrition affecting women and children. We have underweight. We have stunting levels around 17.5%. With the undernutrition is also the overnutrition, which manifests in obesity in both men and women being more than the men, and also overweight. In addition to that, we also have the diet-related non-communicable diseases, which we have not been able to manage so well. So with this background, having to grapple with these issues, we ask ourselves to declare demands. And just last week, the new report came out, the binary report came out, and Ghana, I would say, is not on track. We were on track in 5 out of the 7, suffering with the agricultural investment and then the malnutrition. But this time, we did not feature at all a gloomy picture, but we have challenges which I will highlight as I make the presentation further. Please, the next slide. Yes, if we are talking about issues, coordination of nutrition issues stand out. We have a coordination unit, but we still have entities wanting to operate solo or move and do their work on their own. And we have come a long way with the setting up of a unit under the National Development Planning Commission, which is the cross-sectoral planning group, which looks at all the facets that address the issues of nutrition. We even have an audit system that looks at tracking funding for nutrition programs across the sectors. We won't have funds and we won't have it enough to carry through all our operations. But then we keep on prioritizing and then executing what we will be able to do with funds we may have on hand. Data is also a big issue, and that's where we seem not to be on track with the biennial review reports. And one of them is the tracking of the nutrition data. We have cycles for data collection, and when the time comes for picking data on nutrition and that exercise has not been done, then we fall short and nothing can be added on to push us up. And we also have issues with data at the level of implementation. We prefer to do the concise service and not work so much with the administrative data, some of which are good to go with. So these are key challenges. And of course, we have the political commitments. We launched our cost of hunger study. We made several recommendations. And as I speak, we've not been able to roll out key areas in that report. And that can be blamed for the lack of commitment from the political side. At the launch, one of our ambassadors then at Rome asked a simple question, whether if politicians put pennies and we put everything together, will not take children out of hunger. It was a very quiet setting, but we haven't moved too far away from the status quo. Next slide, please. Yes, so for initiatives that will address nutrition, we have a big program in the agricultural space. We call it the Planting for Food and Jobs, to promote the production of grain, soybean and then orange flesh sweet potato to address vitamin A challenge, as some other crops, but I'm mentioning in every agricultural. In addition to that, there is on biofortification programs. So we've worked on the orange flesh sweet potato, we've worked on high iron beans, the yellow maize, and cassava. And some of these are being supported by partners that include Harvest Plus, and we also have the Potato Center that is supporting research to execute these activities. We also have the homegrown school feeding program, which is targeting the primary school. And with that, we are addressing the cognitive issues because there's high level of retention for that food that is served. It addresses the gender concerns because we have both girls and boys attending school. And of course, nutrition. And then we have supplementation programs, iron folates, and then the vitamin A supplementation that is done. And this targets pregnant mothers, adolescent girls, and children under 5. There's also a deworming exercise that is in place to support iron nutrition because with worm infestation, there's a lot of gut bleeding and blood loss has a key link with anemia. There's also fortification of our foods, and we have salt with iodine, oil and flour with vitamin A and iron respectively. And these are accordingly. Food safety issues being addressed, and we have the certification with the green label, and we have guidelines on food safety for all the municipal, metropolitan, and district assemblies to enact codes to ensure food safety. In as much as we may have food in abundance, if it is not safe, we might as well, because it's going to compound the health. Input is a social protection measure to support minority groups within the country. And then we have our review for the maternity leave to support feeding, and at the heels of that, to ensure a platform that is the cross-sectoral point that is doing its very best to coordinate nutrition activities within the country. Next slide, please. Yes. So from there, we can talk about some achievements and progress to date. And in Ghana, we were able to work on a composite food composition table. That's the one for West Africa, which has been updated. And we also want a Ghana food composition table, and plans are far advanced in that. And we also have reviewed the school feeding program to source foods locally to empower the economies at those locations, and also spread out to cover every district of the country. Recently, we also launched guidelines on school feeding, and that is supported by the Food and Agriculture Organization. I talked about the review of the breastfeeding code, yes, and then we are in the process of developing a food-based dietary guidelines, also to enable consumers to choose and choose wisely to support good nutrition. And there are a few projects that are coming. The first one, Healthier Diets and Healthier Lives for Healthier Lives, is coming at the heels of the just ended UN Food System Summit. And this project, we hope, will also make a mark in the nutrition arena. We also had a malnutrition project run by FAO that supported production and utilization of various nutrient-dense foods. And we also had a JICA program targeting anemia, and that has ended successfully in one of the districts of the country. And that's centered on home gardens, nutrient profiling to get beneficiaries to choose and combine foods that will increase the iron consumption. Next slide, please. Yes. So for some of the lessons learned, the UN Food Systems Dialogues helped a lot in refocusing on our various activities. We had pathways and commitment statements which formed the key elements for our various sector plans, which are being audited as I speak. We also think that we need to improve our data system. I earlier hinted that it affected our position on the CADEP biennial review. We need to see how best we can firm up or make our administrative data reliable for it to be effectively used. The school feeding program also is running, but we are now looking at sourcing foods locally, looking into the bigger arena, inputs not coming in, food supplies running into danger. We need to look internally to boost our production and consume food from our own country. We also promote the need to continue with the promotion of the kitchen gardening. We saw that to be a self-empowering activity, and there are areas where projects have ended, but that sustainability element is lingering and growing. the collaborations we have to also deepen. And yes, for the periodic audits, we need to ever keep tracking our activities. And we've also had the West Africa Health Organization, that is WAHO, supporting cross exchanges. And that is a good one, which we need to sustain. Next slide, please. Yes, so for our learning from other countries, yes, we will look at strategies on nutrition. I can mention one from the National Nutrition Agency in Gambia. There were a lot of lessons to learn from there. And then we also had the multi-sectoral teams, and then the nutrient-focused approaches. All these have helped us to strengthen our nutrition activities. And for the practical ones, the micro gardens around office spaces, workplace policies on consumption of fruits and vegetables, and also incentives for food vendors who add fruits to their service. These are very, very good lessons we learned. And I think I should also not forget about South Africa, Benin, and Sae-Ryo, where we picked a lot of cues from in drafting our food-based dietary guidelines. Next slide, please. Next slide, please. Next slide, please. Yes. So for the knowledge sharing platforms, you mentioned a few: Senegal, Rwanda, Burkina Faso, exchange visits to some of these countries, improving data system to augment the service that we do, and then a tracking system. So we will be duly recognized for being within the recommended space. And I think that brings me to the end of my presentation. I would want to thank you very much. I would be on hand to address any issues that may come up as we move on. Thank you very much.
Thank you very much, Ms. Addy. And I'm thanking you on behalf of the organizers of this webinar, AUDA-NEPAD, IPCIG, UNICEF, and WFP. We are indeed very grateful that you were able to share Ghana's experiences. And let me share 2-3 messages. One is that progress it cannot be assumed. I mean, the fact that you made progress yesterday does not mean you would make progress tomorrow. We need sustainable progress. Thank you for communicating that. The other thing that you communicated very clearly are the 4 key enablers. The first is that this is dealing with nutrition is really a partnership, but it requires coordination. It requires funding, but we need more money and we need to spend it well. And the Ghana's experience on using the audit to make sure funds are spent well is a good example. We need data, otherwise we manage in the dark. And lastly, we need sustained political commitment. Your third message is that a lot of initiatives are happening in countries and that we need to move forward with leveraging the existing platforms for inter-country learning and adoption and for scale. Thank you very much for sharing your experiences in terms of how you've learned from other countries and how you are using it within the Ghana context to move the agenda of nutrition. On behalf of the team, I'd like to say a big thank you. Colleagues, our chat box is too quiet. So let me invite you to at least introduce yourself in the chat box and to share any experiences that you might be having in your own context. But let me also thank Helen Martin for her questions. 2 solid questions are on, and I'll invite my panelists, starting with Kefilwe, to please go to the Q&A and respond virtually to Helen Martin. Please keep your questions coming in. The chat box is too quiet. We want you to please engage. So Ms. Kefilwe, please visit the chat box, and Ms. Addy, if you have any thoughts on the questions from Helen, please visit the chat box, the Q&A, and provide responses to Ms. Helen. So we are moving on with our conversation, and now we are moving from Ghana to Zambia, and our next speaker is Mr. Musonda Mofu. Mr. Musonda is currently the Director of the National Food and Nutrition Commission of Zambia, and is responsible for coordinating national food and nutrition policy implementation in the country. He has over 25 years experience in food and nutrition practice, and has undertaken a lot of research in the areas of food intake, diversity, dietary diversity, micronutrients, and anthropometry, both in Zambia and in other countries on our continent. Mr. Mofu's work in the past decade has focused on nutrition governance and food systems and the preservation of indigenous food system. He has also actively worked in the formulation, implementation, and evaluation of various food and nutrition programs, strategies, and policies. He's certainly not a stranger in this landscape. It's my pleasure to invite you to Mr. Mofu to say a few words about what you have learned in nutrition and the Malabo Declaration report from the Zambia perspective. The floor is yours, sir.
Thank you. Thank you very much. I'm happy. I'm glad to have been to be part of this very extremely important conversation that we are having. As you may be aware, 2025 is just around the corner, and already with the losses that we are making in terms of as a result of COVID-19, you can see that most of the gains that we had made, actually we are losing. And I would like to refer to the presentation given by Kefilwe on the situation analysis on the African continent. And you can clearly see that some other African countries are doing well, but not too many. So the case of Uganda gives us an indication that we can learn quite a lot from there. And as I present the Zambian case, I begin to look at Zambia in the context of how we can learn from other African countries. Next slide. So in general terms, Zambia has made genuine progress in reducing malnutrition and undernourishment since the launch of the Scaling Up Nutrition and the other policy reforms from 2010 up to 2021, and that actually link onto the Malabo Declaration. You will notice that both malnutrition and undernutrition have been showing a downward trend in line with Zambia's vision of having a well-nourished population by the year 2030. Undernourishment has reduced from 51% in 2007 to 44.5% in 2017, but still quite high. Malnutrition as measured by stunting has also reduced from 45% in 2007 to 35% in 2018. Again, still high when you compare with WHO recommended thresholds. But what we have realized is that the annual rate of reduction for malnutrition in Zambia has been very slow, averaging 1% per year, contrary to the country's potential. And I know that many African countries still have this kind of challenge. It is also important to know that malnutrition has far-reaching consequences for human capital, economic productivity, maternal and child health, and national development. And if as a country we are to improve, then certainly the issue of malnutrition and undernourishment has to be addressed in the country and on the African continent. Next. So what we see is that a number of issues have been raised that impede on nutrition improvement in Zambia. The first one include agriculture and food system challenges, inadequate food and nutrition service coverage, inadequate domestic budgetary provision for food and nutrition programs, low agriculture productivity with inadequacy in nutrition sensitivity, as well as multidimensional poverty, as well as systemic challenges to food, water, sanitation, health, and economic systems, which eventually impede on how resources actually feed into the agricultural sector. And with inadequate nutrition sensitivity, then the agriculture sector is unable to provide well-nourishing foods. And again, as we have already indicated, with COVID coming into the space, we are slowly losing the gains. Next slide. So from the perspective of looking at the challenges, we see 4 critical responses from government. One is the recognition that food and nutrition, agriculture need adequate governance. So multi-sector governance structures have been established across the country, and these structures are supported by legislation as well as policies that guide how these structures operate. So that's number one and very important. Number two is that Zambia has put in place a standing committee of permanent secretaries on nutrition from relevant ministries that meet quarterly to oversee policy implementation. This is very important because if the multi-sector approach is not anchored at this level, then you are likely not to make progress. Number three, and which I'll speak about eventually, Zambia has put in place a common results framework that will help in tracking the progress that is being made by all the players in the country. And number four, the country has put in place planning and budgeting guidelines for food and nutrition in all the sectors that direct ministries and sectors to include food and nutrition related action in budget lines. Now, this is extremely important because this response at governance level, these responses at governance level eventually may be translated into action at lower levels. Next slide. So based on these government actions, we see that there are a number of issues or progress that have been made or actions that have been made. Based on the policy framework, government has launched the Healthy Diet Campaign and the Good Food Logo program, which is aimed at raising awareness and accountability of stakeholders for promoting nutritious foods. And this looks at it from the food system point of view, from production up to actually consumption. Number two, government has reviewed the food balance sheet framework to expand it to include other foods. Previously, Zambia had a food balance sheet that was only focusing on staples as well as tubers and cereals. Number three, the government and cooperating partners have put in place food funding for multi-sector food and nutrition response so that the various policy aspects in food, in the agriculture sector, in the food and nutrition sector are actually supported. And of course, number 4, the recent initiative by the UN system to support food system dialogue at national level and sub-national level have actually shown that we can do it if we do it well. Next slide. So based on these initiatives, we see actually that there is some progress on some indicators. If we go back to from 2019 to 2020, up to the end of 2021, we see that the percentage of households that are having a recommended dietary diversity has increased from 19.4% to 59%. We also see that the prevalence of women of the reproductive age who consume targeted nutrient-rich foods has also increased from 34% to 53.7%. We also see that the percent of children who are meeting the minimum standards for IYCF, infant and young child feeding, has also increased from 28.5% to 86.5%. However, like indicated, undernourishment and hunger are still a challenge. The percentage of households with moderate or severe who are severe hungry has gone down, but it is still quite high. And I must mention at this point that although we want to measure progress, the problem of data still remains a challenge. To properly track those communities, those individuals who are not having adequate intake of food is a major challenge. Next slide. And so it is something that needs to be addressed. So what we see now in terms of nutrition service coverage, we see, for example, the percentage of women taking iron supplementation for 90 days has increased from 59% in 2013 to 73%. The percentage of women taking deworming medication has also increased from 64% to 77%. Next slide. And I am aware that although the progress looks like this, where we may lose the gains due to COVID-related effects. So again, we see when you look at stunting, that is a trend from over the past 20 years. We see stunting reducing from over 50% up to 35% by 2018. And what we see basically are variations in the within the age, and we see that the age group 18-23% has the highest prevalence of stunting. We also see that male children are much more stunted than female, and also we see some urban and rural differentials, as well as we see stunting being associated with rural poverty, as it were. And we also see that children whose mothers have no education are more likely to be, stunted, as it were. And so we see from this picture that there is the multidimensional effect of nutrition on stunting. Next slide. The next slide. Again, we also see that apart from talking about undernourishment, we are also now seeing an increasing trend of actually overweight and obesity, especially among women. So it is again very important, and in many African countries, to see that as we deal with undernourishment within the segments of the population, we are also seeing an increase in overweight and obesity, which has its own complications, and especially that many African countries may not have adequate resources to address both undernourishment as well as overnutrition. So it is critical to think about how best to address these on the African continent. Next slide. I think having looked at what we have gone through in Zambia, it is critical to think that there are three things that we have learned. One, multi-sector approach works. And it is very important to learn that there is complementarity within the different sectors, and most of the resources are actually in the different sectors. But if put together, then the level of effort or the achievements to be made will be higher as opposed to sectors working in their own individual sectors. And so the lesson we learned from Zambia is that we have put in place the nutrition planning and budgeting guidelines for sectors, which actually highlight the key actions that need to be made by different sectors with one common objective, which is in the common results framework. And we see that if we identify the multi-sector nature of food and nutrition, we can actually see that much of the resources can be harnessed from the different sectors to in support of the common goal. That's number one. Number two, we learn that high-level engagement is critical, and we see that the putting in place of the standing committee of permanent secretaries on nutrition is actually helpful in driving the agenda, especially the multi-sector plans that have been put in place. And number three, we'll also learn that the other existing platforms, for example, the scaling up nutrition, can be used to accelerate efforts in the agriculture sector. And in this case, when we look at CADIP, as well as, the Malabo Declaration, especially that looking at 2025 as being near. So it's extremely important to learn, to look at those lessons. Next slide. Now, what we learn basically is that in Zambia, I know that I've given a presentation and it appears that things are okay. No, they are not. This is because the problem of data, the problem of information is very real. It is extremely difficult to generate data from community level to the national level and aggregate it into a national picture. And so what we learned is that Tanzania already had a common results framework, and Tanzania already had, targets at community level, and they were collecting data and they were able to show which regions are performing well on critical indicators in the agriculture sector, in the nutrition sector, and in the wash sector, in the water sector, because you need water to support the agriculture sector. And so Zambia decided, after learning that Tanzania was supported through UNICEF to put in place these mechanisms, Zambia approached Tanzania to learn how Tanzania did it. And Tanzania made available consultants whom we were able to exchange notes and guided us as Zambia to put in place what we call the food and nutrition common results for the country. And some of the information have been used now to develop what we call the multi-sector report framework, where we get information on the specific aspects. It is not yet fully operational, but we think we still need to learn a lot more from Tanzania and be able to, especially the scorecards that Tanzania has at lower level. So we think that we can learn more from Tanzania and help implement the common results framework for Zambia. So I think that is one important lesson to learn. Some of the resources, some of the consultants, some of the materials actually exist within the African countries and in the African continent and within the regions that where we are. And I think we hope that we can learn even more from our colleagues from Tanzania. Number two, we also learned that when we were developing the Scaling Up Nutrition Global Strategy 3, within the SADC region, a meeting was convened for this region. And we learned that countries had different landscapes of nutrition and yet addressing the common issue. And so we learned that there are certain things that can be done differently if we are to learn. And looking at the presentation that was been given by Kefilwe, where we learn of how Uganda, for example, is doing well. I think it is just the correct thing that we try to learn from Uganda, why they are in green and the rest of us are in red. I think it is very important that South-to-South cooperation, triangle cooperation, be enhanced in the on the African continent and within the specific regions so that we are able to learn. But with this requires a policy in place. Next slide, which should be the final. So I think it's extremely important that we put in place regional policies and strategies on South-to-South triangle cooperation in food and nutrition on the African continent, SADC, COMESA, and EXA, in order to gain maximum benefit from this, from what other countries are experiencing. So, Chair, Dr. Addy, thank you very much. I think that is what I wanted to share on the part of Zambia. I thank you.
Thank you very much, Mr. Musonda. I think the good experiences that you have shared today, as well as the practical ways in which you have learned with countries, is a very, very good segue into the next session. I think you have reinforced a lot of the messages that came earlier, but what struck me is the way you started your presentation, the humble note on which you started your presentation, and I wrote down your quotes, which says that we can learn from each other. And I'll add to your quotes that indeed we must learn from each other because there are good things happening across our continent. So as I said, it's a very good segue into the presentation of our next speaker, which is really about experiences from WFP on facilitating South-South and triangular cooperation in delivering SDG 2 targets. Our next speaker is Ms. Carola Kenngott. She's currently the head of SSTC Global Team at WFP headquarters in Rhoba. Ms. Kenngott has worked at global, regional, and country levels with different multilateral and bilateral agencies for sustainable development. Prior to her current position, she worked on country capacity strengthening, program support, and aid effectiveness with UNDP in New York. She was also part of the joint OECD-UNDP task team facilitating the implementation of global partnerships on effective development cooperation. Their vast experience included assignments with UNDP, the Regional Bureau for Latin America and the Caribbean, and with the German International Development Corporation in Ethiopia as monitoring and evaluation and climate change coordinator. Ms. Carola, the floor is yours. But before you take the floor, I want to thank two people who have engaged with us, Gilbert and Sri Kiram. Thank you for your questions. I'd like to invite Ms. Addy and Mr. Musonda to go to the Q&A box, chat box, and try and provide live responses to the questions from our very interesting questions are there for you. The floor is yours, Ms. Carola.
Thank you very much, and I hope you can all hear me very well. It is really a pleasure to be with you here today. My name is Carola, and I'm heading the Global South-South Cooperation team in WFP. I just wanted to share a couple of experiences from the World Food Programme on facilitating South-South cooperation with a focus on nutrition and on advancing country-led progress towards zero hunger. Next slide, please. Perfect. So South-South cooperation and triangle cooperation is really, for us, a means to bring two or more developing countries together that share similar challenges have experiences to share in order to leverage those important homegrown innovations, technologies, knowledge, skills, resources to facilitate peer learning in many ways in order to address concrete problems of food security, hunger, and nutrition on the ground. And I can tell you that in WFP, it's become really a key pillar and an increasingly important strategy of facilitating South-South cooperation in order to promote country-led progress towards zero hunger. As so many of the most innovative ideas really lie and have been developed in countries in the global South, and we would not be able to do it without them. So for us, as for all other UN agencies, we are really seeing our role as a convener, as a knowledge broker, partnership builder, analyst, support in the facilitation of those exchanges. Next slide, please. As I just mentioned, strengthening country capacities and country systems for progress on SDG 2, the zero hunger goal, is really at the heart of our work on South-South cooperation. And over the last few years, WFP's work on South-South cooperation has grown tremendously from an initial very strong focus on school feeding, particularly thanks to our centers of excellence in Brazil, in China, in Cote d'Ivoire. But now really we have established ways and avenues to partner, bring countries together and broker South-South cooperation in areas such as nutrition, social protection, value chains, food systems, sustainable and inclusive food systems, including post-harvest management, very famous topic, food security analysis, but also when it comes not only to changing lives towards zero hunger, but also saving lives in areas such as emergency preparedness, supply chain, logistics. That's all areas where we are brokering South-South. We do it through a network of country offices, regional bureaus, centers of excellence, and really leveraging WFP's global arm in 80 countries, and very often in some of the most difficult places in the world in the deep field. Next slide, please. Just generally a bit on how we are structured and how we're set up. So our approach to brokering South-South cooperation is certainly demand-driven. The host government, a country that comes forward and expresses a need or an interest to engage in WFP brokered South-South cooperation, either share an experience, because literally every developing country we have worked with has experiences to share that are valuable, or on the other hand, to say here we have a capacity need, for instance, or an interest in tapping into a specific experience, technology from another country, and then the brokering process starts. Our work on South-South cooperation focuses on creating benefits for the most vulnerable people in this world. So when we look at South-South cooperation, one of our principles is really always to ask ourselves the questions, how do the most vulnerable people that are actively threatened by food insecurity and hunger and malnutrition, how do they benefit from South-South exchanges, and how can we maximize this benefit? We also, of course, very, very strongly really prioritize and look at opportunities to partner with other South-South brokers that are out there. Today, it's a first example, of course, with our strong and very valued partner, AUDA-NEPAD, with UNICEF, with very often the other Rome-based agencies, FAO and DFAD. There are so many examples of country-led institutions, but then also international agencies with whom we really try to combine our strengths and jointly set up and broker those South-South exchanges for progress on zero hunger. We try to influence at 3 levels. The one is to drive change at the policy level. So really using South-South cooperation to bring some of the most innovative and successful strategies to the attention of policymakers, and having them really to prioritize and focus on interventions that help to change lives and promote food security and nutrition. to empower experts at the technical level. So that's very often through study visits, peer learning networks, trainings, technology transfers, also joint problem solving, sometimes on the ground, and field experimentation, which is really from farm stays, exchanges there, on the job coaching, in field demonstrations. There are many examples. Next slide, please. Our service offer is comprised of 4 pillars. The first one is really about scoping South-South cooperation opportunities. So that's done through country-specific South-South reviews, which are usually kind of an analytic piece, a 1-week in-field mission where we try to meet as many government partners, research institutes, private partners that are having a role in tackling hunger and malnutrition, and to really listen to them, to hear from them, what are the experiences, what needs do they say in their country, but on also what offer do they think they could bring to other countries in the developing world, and to match those, bring them together and develop a concrete set of South-South investment opportunities. Regional mappings, where we're trying to capture this whole thing on a regional level. The second one is really about testing South-South opportunities in the field. So seed funding, whereby country offices work with host governments to implement South-South cooperation projects on the work in the field, and where we really see what generates the best benefits for the most vulnerable people, what can we scale up as well later on. Longer term, capacity strengthening pilots. So apart from one-off exchanges as we have it right now, for instance, in response to COVID-19, we also have long-term country capacity strengthening South-South projects and programs through our global field pilot initiative together with MARA in China. And then we have a pillar on strengthening visibility and evidence for South-South cooperation. So those are really kind of more reports capturing M&E exercises, findings from those field level interventions, and bringing them to the advocacy level. Next slide, please. These are just some of the figures and findings from our work. So right now we have 33 pilot projects in implementation in 28 countries, with 10,000 direct beneficiaries and 1 million indirect beneficiaries from them. 60 knowledge products have been developed through this Global Field Pilot Initiative over the last 3 years. And yeah, generous seed funding has been mobilized from different partners that help us to capture their service offer in the provision of South-South cooperation, but then also that allow us to realize those projects with seed funding opportunities. Next slide, please. So nutrition. Nutrition is really an area where we see so much traction, as we can also really see that very often the peer learning advocacy among countries in similar food security, nutrition circumstances, or geographic regions, or in cooperation with other developing countries like China, Brazil, India, South Africa, can really have a much more direct and concrete targeted contribution than always the assistance from developed countries in the north. So we try to really leverage South-South cooperation engagements through the field pilot modality that I just mentioned, through trainings to support and roll those out, and certainly in areas such as nutrition sensitive social protection, including homegrown school feeding, food fortification, for instance, in the area of rice, then evidence-based advocacy tools, such as very early onwards, the cost of hunger in Africa, the cost of malnutrition studies in Africa, in close collaboration, of course, with AUDA-NEPAD and many institutions in Africa, stunting prevention, HIV and nutrition. Those are some areas where we have South-South experiences. Next slide, please. And just to give you a glimpse of how this looks like on the ground. So for instance, Ethiopia just received support from China through our COVID-19 South-South Opportunity Fund to develop local fortified noodle value chains for refugees, because it was really aimed at responding to the needs of the government in terms of food preferences and nutritional gaps for both refugees and also school-aged children in Ethiopia, which are also assisted by WFP. And WFP, in collaboration with the China Center of Excellence, supported the Ethiopian Agency for Returnee and Refugee Affairs to tap into technical assistance from China and develop sorghum-based fortified noodles. So that was just an example of how kind of really the preferences of refugees and local children were taken into account in order to improve nutrition, tackle malnutrition, and to also generate value chains that can reach those that need it the most. The next slide, please. Yeah, and then another example is knowledge sharing between Benin and Togo on food security and nutrition analysis through WFP Center of Excellence in Cote d'Ivoire, SERFAM. This project helped Togo to identify and integrate new food and nutrition security indicators into their national monitoring and evaluation mechanism. So more and more we really focus on promoting those intra-regional exchanges, on those kind of really, also very often grassroots initiatives or strengthening M&E mechanisms that help us to monitor and identify those food security and nutrition risks, interventions, and progress of programs. So thank you. Those are just a couple of things that I wanted to show, and just to say that the potential for strengthening our partnership and really jointly brokering and bringing South-South cooperation to bear is enormous. Not only with regards to just looking at food security, nutrition, but also all the links of all the surrounding and connected elements that are related to it. Yeah, so if we look at refugees, if we look at the benefits in strengthening of sustainable, inclusive food systems, I think nutrition is so much at the heart of much of it. And I think bringing South-South cooperation in the area of nutrition to scale will really make an enormous contribution. So thanks. Thank you very much to all partners involved, to the organizers, and we very much look forward to hearing your comments and to further partnering with you. Thanks.
Thank you very much, Ms. Carola, for sharing these practical experiences and opportunities that exist on our continent and for which we can leverage. Really appreciated on that. And colleagues, the presentation will be made available to all of you, so be reassured. I know Ms. Kefilwe Moalosi has been very busy on the chat box trying to respond to questions. So prior to my colleague, Ms. Kim coming in, may I give Ms. Moalosi, if she can promise me, because we've run out of time, just a minute to respond out of respect to all the colleagues that have been putting questions, to say a few words about what she's seeing, and then she would hand over to Ms. Kim to summarize, and then we'll draw down the curtain. So please bear with us. We've not done pretty well on time, but let's see how it goes. 1 minute, is it possible?
Thank you so much, moderator. You're doing an incredible job. I think most of the questions are around what is AUDA-NEPAD doing in terms of addressing issues such as the post-harvest losses. And I just answered to say that, for example, we have the CARA framework that many countries in Africa are actually implementing. And within the CARA framework, we have key indicators that really addresses issues of post-harvest losses. If you look at the Malabo Declaration, we have to have the post-harvest loss by 2025. And we encourage many countries, for example, to improve the food storage infrastructures. In many countries, we don't have, in Africa, we have poor food storages. And sometimes in other countries, like I was in Uganda the other year, where WFP was providing a practical food storage that the community can actually use in terms of preserving the food that has been harvested, and also preserve the nutritional content of the food that has been harvested as well. So we do also have some policies on food safety. We have partners that also work around the food safety issue. We have developed the food safety framework through AUC as well. We have AUC PACA that also work on aflatoxin issues that they are targeting in 6 countries in Africa, and now increasing up to 10 countries. So we have those initiatives that are being implemented by different partners across board, but we do have a framework, which is Malabo framework. So in terms of what are the key lessons of what countries are doing in terms of achieving the Malabo, such as Rwanda, for example, we do know that, for example, it comes with the political commitment, political leadership, and many countries, for example, do not have a very strong political will when it comes to nutrition investments on the ground. But we took lessons from Rwanda and from Zambia right now, and Ghana, sharing with us some of the key lessons that they're doing on the ground in terms of addressing issues of nutrition in Africa. For Rwanda, for example, or Uganda, for example, the political leaders there are very, very strong. For example, President Kagame, we have seen him also moving the torch around the African commitments when it comes to nutrition and food security. Last day during the Food System Summit, he also actually launched the African Common Position that also pushed for more investment on nutrition. When it comes to coordination as well, that also contributes to the Malabo Declaration reporting. If a country has a week, I'm
certain that you have so much to say. So,
yes.
So let's stop here in the interest of time. Is that
just
okay?
To say the coordination also is very, very important at the country level in terms of really addressing these key issues of nutrition. Thank you so much.
Thank you very much, my sister. Okay, so Kim currently manages the China offices, UNICEF China offices, South-South cooperation, and leads our efforts. And she's done a lot of work in partnerships. But let me save that in the interest of time and invite Kim, Miss Sae-Ryo Kim, to conclude our meeting for us. The floor is yours, madam.
Thank you, moderator, and thank you so much to the speakers for the excellent presentation. I do want to acknowledge all the passion and the hard work that has gone into each, not only the presentation, but the work behind and the thinking behind it. I think, I will not do a good service of trying to summarize everything, and we will have a full-fledged report that will be shared with all the participants. Just wanted to highlight some of the critical messages that we heard today. Ms. Kefilwe's presentation, I think, really set the tone of our webinar tonight or this morning to many of you. It underlined the urgency of addressing malnutrition and undernutrition in Africa. And we heard the message loud and clear that many countries actually are not on track to end hunger. And on the contrary, hunger is on the rise in Africa. I think the shocking number, and it should be a wake-up call to many of us who are working in this area, that 49 of the countries are not on track. I think we've also heard, but it was also heartening to hear about all the frameworks that are being implemented, all the guidelines in place, and the highest level political commitment and the tools that are available to address these issues. The presentations from Ghana and Zambia were really, really rich, sharing their experiences. Some of the common things that I heard was the importance of comprehensive approach and multi-sectoral approach, focus on the policy level work and how it is important to plan and have this all already included in the budgeting guidelines for nutrition. Awareness raising, and with a commitment at a high vice presidential level in Zambia. I think that one common challenge in both Ghana and Zambia that stood out to me personally was the undernutrition in women, the obesity of women that is higher than men. And it just highlights the fact that how important gender dimension is in nutrition. I think the recommendations from the speakers, I just wanted to recognize the continued importance of continued collection of empirical data, sharing of information and good practices among countries, and investment in the food systems, but really a wholesome approach to things so that we better integrate nutrition services in healthcare systems. Overall, I think all the participants stressed the key role of South-South cooperation, South-South and triangular cooperation in ending malnutrition. WFP's presentation was very, very clear on how important it is to have a structured way of facilitating knowledge exchange between the countries, and the intersectoral approach as well. The policy level, the South-South triangular cooperation, the technical level support, I think all builds towards the having a successful exchange between countries, really driving change for, as Carol mentioned, the saving lives and making changes in the lives of people for zero hunger. So in terms of the next steps, AUDA-NEPAD, IPCIG, UNICEF and WFP, we will share with all participants the presentation, the summary report and recording of the webinar. And the stakeholders, partners are committed to continuing to showcase solutions and good practices on nutrition and initiatives towards SDG 2 and the Malabo Declaration goals. Many of these have been documented by partners, but I think it will be very important to continue to further document and also facilitate and disseminate this knowledge through country-to-country learning. And driven by country demands, building on the outcomes of this webinar, the partners aim to increase South-South and triangular cooperation exchanges and learning amongst countries in Africa, as well with other regions where solutions and lessons can be applied in African countries. Strengthen partnership, just to conclude, is for South-South and triangular cooperation for nutrition, and it will contribute to real action and results. So thank you so much for attending, and thank you so much for giving me this opportunity, moderator. Over back to you.
Thank you very much, Ms. Kim. I'd like to draw down the curtain, but before I do so, let me thank AUDA-NEPAD, WFP, IPCIG, and my colleagues in UNICEF for putting together this particular webinar. I want to particularly thank the team from socialprotection.org for hosting the webinar. I want to call on all of us to stay engaged with this particular issue, to reach out to the organizers for follow-up, and also to take the survey that would be administered soon after this webinar. And with that, I'd like to draw the curtain and thank you all, each and every one of you, particularly the speakers and the participants as well, for joining us. Do have a good day, and bye for now.